Ever? All right.
No,
904.
I've done drifting, but I'm not drag racing.
All right, let's go back into the KUM News Zoom room where we have Mark Scott, who's the spokesperson for the Guam National Guard. Good morning, Mark.
Oh, unmute, unmute.
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 All right, how's that?
Hey.
A little better? Good morning, Chris and Bree. Hi, Jason. Hapaday, people of Guam. Good morning.
Good morning.
Good morning. So, yeah, we wanted to kind of catch up with you because it's been a minute, as the kids say. So we'll just give you the floor for a bit. I know that you had sent me a little message about some of the stuff that you guys have got going on with the Guard. So just go ahead and touch on those. You guys are doing COVID positive transports to the isolation facilities?
Yeah, we're doing a whole bunch of stuff, guys. As usual, some of the missions that we've had have not changed, and we're still continuing with those. Let me start from the top, maybe, for some folks who might not be tracking exactly the Guard's role in all of this. So as some people may know, out of a population of a little over 1,000, we have about 250 folks, that's soldiers and airmen of the Guam Guard, dedicated to COVID response. So out of that, about 250 people, that's called the Joint Task Force, right? JTF 671. There's a handful of other sub-task forces, and they're all doing different things around the island. Some of those that people know probably the most about is the quarantine facilities. That's at the Dusit Beach Resort and the Dusit Tani. We're also out there with Task Force Response, which is helping the Northern Clinic do their public testing for COVID-19. We're also helping out with the commodities distribution. And yes, a part of the Task Force Response's role is also to provide transport for COVID positive patients to the isolation facility at the Bayview. We also have 8 medics at Guam Memorial Hospital helping out with some acute care and triage and taking vitals and stuff like that. So these are some of the ongoing missions to include our task force engineer that we've been doing for quite some time now. Some updates to that, some of the new things we're doing. We've erected some tents recently at GRMC for their testing and evaluation purposes. We do some generator repairs at GMH recently. We're looking at helping DPHSS move the contact tracing operations over to the Hakabatan building. And we're also looking at helping DPHSS with some planning and operations. The bottom line is that we're continuing to support all of these GovGuam agencies. We play a helper role. Well, we're not the lead, but we do what we can to assist as long as we're needed. So some other updates, you guys, out of about those 250 folks doing the COVID-19 response, we do have currently right now 3 positives who are in home isolation. Contact tracing was conducted with 1 additional person who had to go get tested. And I'll have to get you guys those results as soon as they come back in. The good news is that all these folks who are out there doing their jobs in these task forces, have been compliant with wearing their masks, staying socially distant, right? So we reduced a lot of the contact tracing that came from those 3 positives. Overall, aside from the 3 positives that we had in the JTF, that brings our total for the Guam National Guard up to about 15 total positives, with only those 3 active right now. So that's what we're looking at, you guys. In addition to those things going on, of course, we always like to say thank you to the people for your support. Thanks to the soldiers and airmen out there doing their thing, and thanks, of course, to their families and to their employers. So that's a little snapshot of what we got going on right now.
Hey, Mark, this is Jace, man. I got a quick question. I've always wondered since the pandemic started, right? How has military training, even going all the way back to basic training, and people going to boot camp, how has that been affected? By COVID. I've seen some stuff on Snapchat about, kids going to the service academies and they say they have to basically do a isolated quarantine for 2 weeks before training begins. But, either if you're doing, AIT or you're doing something for your military specialty or you're just beginning your military career, how has that all been affected?
Yeah, that's right. So they've added in those risk mitigators, as they call them. All those implemented things that kind of reduce the risk. But you're right, the training does not stop. Training goes on. That's true for basic training, where they have an initial period of quarantine from each other. As they continue through their basic training, they have like social distancing, right? Where they've eliminated certain, hand-to-hand combat and things that take people closer together, and they found ways to keep people socially distant. So those are going on in basic training. Here in Guam, our training also continues. We have, it's right now, it's National Cybersecurity Month. So we have an activity recently called Cyber Shield, where some of our IT folks learn how to do, cyber defense of our network here. We've had some certifications and people going through school. And these are like all knowledge and skills that we're going to be sharing with the local government here on Guam. There's also additional training with, you've seen in the past with collaborative training with our RTI, which is our Regional Training Institute, in collaboration with University of Guam's ROTC, where we're training our future leaders to be cadets and officers, of course, following all of the guidelines for social distancing and mask wearing and stuff like that. So long story short, Jason, we're still training the force. We're still staying in the fight. We're still protecting the force, but the training goes on.
Okay, and then for Guamanians who feel like a calling and they want to be part of the military and they want to serve their nation, and like if they want to actually enlist, what should they be thinking as far as, because everybody on Guam's got like an uncle, an auntie, a godmother who has served. So what should they be preparing for in terms of like their transition or the indoctrination into as they begin their training? Like if they want to serve in the Guard and they're getting ready for training, what kind of delays might they expect?
Well, first of all, Jason, it's a great time to serve, and thanks for that question. Anyone who's considering stepping up and doing their part, right, for our country and our island, has my respect, has all of our respect, regardless of what branch you decide to join. It's a very brave time. It's a very needed time for you to join. So if that is something that you're thinking about, anyone out there, kudos and hats off to you, right? Because your help is definitely needed. Now, with regards to delays and things like that, we're still having folks enlist. They're still going through the pipeline and going off, shipping out to basic training. So there's not going to be too much of a delay, more than normal. The only thing that would be different is maybe your whole clan of 50 extended family won't come to your enlistment ceremony. Maybe I'll just take your picture and put it on Facebook. But aside from those social distancing measures, everything would go on just about as normal. So if you are interested, please roll over Facebook and Instagram. You can hit me up on our Guam National Guard Facebook or IG pages. We also have recruiters on their pages as well. So go ahead and reach out to us and we'll help you through.
Thanks, Mark.
Okay, I wanted to follow up on the 3 positives, the 3 people that recently tested positive with the JTF. Did they all work together, or are they from different areas that they were assigned?
Yeah, I heard that they're from one of our task forces, Task Force Shield. And to my knowledge, so I don't have all the details because there is some privacy, like health privacy information, but from what I've heard, yes, they do work together and they've all been home isolated. Mm-hmm. Now, when the contact tracing was conducted, because they are following all those safety protocols, the amount of other people that they could have contacted was only 1, right? So per the CDC guidelines, I think a contact trace has to be within 6 feet for 15 minutes. And the good news is that there was only 1 contact traced from those 3. Mm-hmm. So even though, of course, it is bad news for us to see anyone getting infected, at least it shows us that they're doing the right thing and they're minimizing the contact with others.
Mm-hmm. Can you say, are these 3 assigned to like the QFAC or the ISOFAC or?
I think so. Yeah, I think they were assigned to the Dusitani.
The QFAC.
Correct.
Okay.
And I can get back to you with a confirmation, but that's what I think so. Yes.
Mm-hmm. What's this medical tent at GRMC?
GRMC. Okay, so like any other agency that requests for help, we call it an RFA. Of course, we have acronyms for everything, right? A request for assistance comes in. And GRMC needed a shelter in addition to their main structure that they could use to test and evaluate people who are suspected of being COVID positive, right? So it keeps them away from the main population of the hospital, and it allows them to conduct their testing and evaluation of suspected positives. And we put it up in the back parking lot last week.
Mm-hmm. But you said any other government agency. They're not a government agency.
No, they're not necessarily a government agency. So an RFA can come through if a private So if an if an entity requests to the government, and then the government can go ahead and make that request of us, that's the process that it would go through.
So we could, if GMH wanted a medical tent set up for this same service, they can. This it would likely be done for them as well.
Yeah, and there, we put up a tent there too. Yes.
So there's one there currently, as in today.
Yep.
Okay. Just wanted to make sure. So is the GRMC, is this paying the Guard or the government for this service or the services that we provide?
The funding thing, Bree, you'd have to ask probably, I'm gonna guess, the funding source. I know it flows through like Homeland and FEMA and stuff like that. We don't deal with like receiving payment or any billing people. You'd have to ask those guys. I'm sorry, I don't know that.
It's okay. What about the contact tracing to Hakapatan? When is this Hakapatan contact tracing going to open? What is that?
So I know last week we helped public health with an assessment of it, and our engineers went there and we looked at things that need to be done, like dropping internet lines and things like that. So as supporters of public health and their operations, really the timetable is theirs. As soon as they're ready to go transfer over, we'll move our folks with them as support folks. So again, the folks that we have embedded with public health contact tracing teams, they do things like call folks who are in home quarantine, call folks who are in home isolation. And they just check on them and see if everything's okay. But the overall responsibility for that operation is with public health, and it's their timetable to move.
Okay.
Anything else in closing, Mark, you'd like to add?
Yeah, of course, you guys, just like everyone else, please continue to stay safe, wear your masks, stay at home. You're safer at home, right? Continue to social distance and practice good hygiene. I'd like to say thank you again to our soldiers and airmen who are out there, the families and employers who support them, and for all the support we get from all the good folks at the quarantine facility. Thank you for your letters, your notes, your little thank you gifts and things like that. They mean all the world to our soldiers. And not to forget those folks who are not pleased, the folks who have things to say that they're not happy with. You know what? We appreciate you all as well. Because here in the military, what we believe in is free speech institution. So voicing your concerns to us, whatever we can do to help you make you stay more comfortable, please continue to do so.
Mark, before we let you go, every year the Guard puts on an event over here at the Barragata Readiness Center for Halloween. Are you guys canceling that?
No, we're looking at it right now with a little change. We're looking at a drive-through right now, and those plans and all those meetings are underway.
Okay.
So the latest plan that I saw was that they may have folks come on in and drive through, similar to how they do the commodities distribution at the mayor's office, where they'll roll the back window down or pop the trunk, and we'll just kind of drop a bag in there with minimal contact or no contact between people.
Are you guys gonna have the good candy or the like candy corn?
What do you want? What do you?
I'm just thinking, Guard, bottomless budget. I want to see some chocolate, special dark Hershey's, maybe.
I don't know about
bottles.
bottles.
MREs, man.
Oh, MREs too. That
Dude, MREs are good.
I like the thing you cook the food on.
Yeah, a little sterno thing.
Yeah.
Yeah. Okay. All right. Thanks,
right,
Mark.
Mark.
These guys are getting a little wacky.
Don't mind my friend Jason. He doesn't get out much. None of us do.
MREs come with Skittles now.
Keep us posted, though, on what you guys are going to be doing.
Yeah, okay. Stay in touch, you guys. Be safe, take care, and have a good week.
You too, Mark. Thank you. Appreciate it. Wash your hands on the way out. We'll take a quick break. 9:19. This is the link on the breeze. Good morning. It's proudly brought to you by Cabo Enterprises, IT&E, the Thrive Coalition,